Good morning, and thank you for joining us for the May 12th COVID-19 virtual news conference. My name is Mariah Miracle, and I'm a public information officer working in the Humboldt County Joint Information Center. Let's start by introducing this week's panelist, family nurse practitioner and vaccine task force member, Lindsay Mendez, operations chief in the Emergency Operations Center, Sophia Pereira, social services deputy branch director, Kelly Hampton. And just really quickly, for those of you who aren't familiar, social services oversees many of the county's benefit programs, such as CalFresh, CalWorks, and employment services like Welfare to Work and the Employment Training Division. And we're also joined by County Health Officer, Dr. Ian Hoffman. So each panelist will now give a brief update on what they've been working on in relation to the COVID-19 response before taking questions. Let's start with family nurse practitioner and vaccine task force member, Lindsay Mendez.
Hi, Humboldt. I'm here today to give you a little bit of an update about what's happening with the COVID-19 vaccine right now in our county. We do have exciting news all around our country right now that we're going to be opening up Pfizer to the younger population of 12 to 15. We are hopeful that this is going to happen by the end of this week. Right now, though, I would like to warn everybody that we do not have mass vax clinics currently prepared for Pfizer this week, but we're hoping to organize a clinic in the later days, and that will be covered by another one of my task force members, Sophia. With that said, though, about the 12 to 15 population, I would urge parents to take the time now and sit down with their children and talk to them about the importance of this vaccine and hopefully getting rid of some fear about needles or vaccinations so that we can end the pandemic sooner and we can all be safer and healthier. With mobile vaccination updates, it's exciting to know that the state of California has helped us with putting a box on My Turn to say if you are homebound and in need of a vaccination because you cannot get to an appointment with your doctor or go to a mass vax. And so we are currently getting these lists from the state of homebound patients so that we can put them into our mobile program. So I'm going to just say that one more time. If you are using My Turn, which hopefully you are to find your vaccine, and you are homebound, there is a box on My Turn when you go to register for your vaccine to say that you cannot make it to your appointment. And we are currently utilizing that in our planning. For other mobile vaccination sites, we are going to be in Samoa this week on Friday. And if you are in that area, you may be getting a lot of notifications from community partners, but we encourage anybody who would like to get their vaccine at Samoa to please go to My Turn and look for that clinic today, and you can sign up. This is a Janssen clinic or Johnson & Johnson. And that's our big updates with mobile. Rest assured, we are going to be going to other locations in the county as we continue to plan, and the task force is working on these sites right now. Also, facilities who need to have a vaccination. I think that currently we are doing second doses in our own clinics of Moderna and Pfizer, and so if you need your second dose appointment, please be sure to show up on time to the appointment that you've been given, or if you need to change your appointment, go to My Turn or call the JIC at 441-5000. My last thing about platforms for, aside from My Turn, is Vaccine Finder. Just reminding everybody that there's another place that you can go to called vaccines.gov, and you can look at using your own zip code for a specific vaccination type, say you want to use Pfizer because of age, then you can click that button and you can find any place in Humboldt County or in your surrounding area that may be giving that vaccine, whether it be CVS or Walgreens or Rite Aid. So please use your resources. Talk to your children about what it means to be vaccinated with the COVID-19 vaccine, and also be sure to be looking for clinics that might be in your area. Thank you very much.
Thanks, Lindsay. Sophia, can you share an update from the Emergency Operations Center?
Yeah, good morning, everyone. I'm Sophia Pereira. I work for public health and serve as the EOC's operations chief for the COVID-19 response. So for a bit of context, the EOC operations section is focused on the planning and execution of the incident's objectives, such as vaccination, testing, and contact tracing. Our operations section is mostly made up of public health and Department of Health and Human Services staff, since this is a public health emergency. So we in the operations section make sure that our operations on the ground have the resources that they need. For example, we're working with our logistics team to make sure that we have the staffing and supplies ready for our vaccination clinics. So last week was our first full week of mobile clinics, and this is a part of our transition, moving from that mass vaccination model that Lindsay has referred to that we have done over the past several months. And this approach is going to be a blend of reaching those that are in care homes, those that are homebound, and reaching harder to reach communities, whether there's transportation barriers or other barriers. We want to make sure that we're reaching people where they are. And this will be something that we will be doing for the foreseeable future, this mobile outreach approach. And so, like Lindsay mentioned, with the 12 to 15-year-olds now newly being eligible for Pfizer this week, we are planning a first dose Pfizer clinic next week that we will be putting the information into My Turn probably later today. So stay tuned for that. We want to make sure that we're providing a first dose clinic for those that are newly eligible. Also, our testing team under the North Coast Testing Partnership, this is a partnership that we have with United Indian Health Service, and recently there's been a launch of adding vaccination to that. So UIHS is providing that vaccination support, and if folks are interested in the schedule for the North Coast Testing Partnership, either to get tested or to get vaccinated, you can go to northcoasttestingpartnership.org. And they go to communities like Oric. They were just out there on Monday and saw a really positive response. So definitely encourage folks to go to northcoasttestingpartnership.org to get that schedule as well. Thank you.
Thanks very much, Sophia. Kelly, can you please share an update?
Good morning, everyone. My name is Kelly Hampton. I'm the Deputy Branch Director for Social Services. My COVID update is just to say that social services has been open the whole time during the pandemic. We've never closed our doors. We have enhanced services so that there are multiple ways for people to apply for our benefits, either in person, online, or by phone. So we have made adjustments so that we can be more available to our community in non-traditional ways. For most parts, we would have people visit our office. Now they can get services provided multiple ways. I don't have too much to add, more to add, because it's been business as usual for us during COVID. We are considered essential services, like much of DHHS. So it hasn't been too much of a change, other than dealing with the additional benefits that the state and the feds have given or released to give to our consumers to help get them through the pandemic. So we get a lot of questions regarding those additional benefits, and we answer those questions primarily through our call center. But other than that, I'll wait to see if people have questions for me.
Thanks very much, Kelly. Dr. Hoffman?
Thanks everyone for being here. As we know, we've seen an increase in COVID activity in our community in the last few weeks. And I just want to take the time to continue to remind everyone that COVID is definitely still here and circulating among us. You know, we want to continue this vaccination effort as quickly as we can to you know, get to those folks who haven't had a chance yet, have barriers like Lindsay and Sophia mentioned that we're trying to overcome by, you know, reaching out into the mobile vaccination unit, going out to outlying remote communities, looking for places where people are wanting the vaccine, but just haven't had the resources or the means to get to one of our clinics yet. And, you know, want to remind everyone the steps that are needed to continue to protect us in this pandemic. And vaccination is definitely way at the top of the list now. We also are going to continue to recommend masking and distancing and avoiding large gatherings. Cases we're seeing are often involving gatherings of folks who are unvaccinated and not using all the precautions that would help stop the spread. We've seen an increase in the UK variant in our community with last week more than 40 samples coming back sequenced for the UK variant. So we know that that's now the dominant strain circulating in Humboldt County. We have seen the hospitalizations come down a bit in the last week, which has been really good news. Although I don't think we're totally out of the woods yet because of our continued drive to look for people who need to get vaccinated, who want to get vaccinated, and overcoming those barriers. Other things we've been working on this week, like Lindsay and Sophia mentioned, we are preparing to open for the 12 to 15-year-olds. And preparing providers in the community, preparing our own clinics through public health so that we're ready and have appointments available. For those who are eager to find an appointment, I would definitely encourage you, like Lindsay said, to get on My Turn tomorrow, Vaccine Finder. Both of those should show some appointments. We might not have them in public health until tomorrow or the next day, but look for those later this week. But there could be others. And just want to say, if you're a member of a doctor's office who has been doing vaccination, those doctors, as they have throughout the whole pandemic, will reach out when clinics are available to that age group. So I want to encourage people not to call their doctor to ask for an appointment because we do want to give them time to prepare. But I would encourage people to reach out to their doctor to ask them questions if they are unsure about this. Should my child get the vaccine? Should I get the vaccine as an adult? I think that talking to a trusted medical provider is a really important way for us to get the information that we need. And obviously in a mass vaccination clinic, we don't always have a trusted medical provider there. Your doctor's not there. And so if you're unsure about getting this vaccine because you haven't talked to your doctor, that would be a great reason to reach out to them. And then go on to My Turn or Vaccine Finder and look for an appointment. So those are the things that we've been working on. I've been working on at Public Health, and look forward to the discussion. Thank you.
Thank you, Dr. Hoffman. Now we'll take questions from reporters. We'll start with the Time Standard, Isabella Vanderheiden.
Hi, thank you so much for taking my questions. So the county remains orange after fears that we were going to revert to the red tier on Tuesday. There were 45 cases reported Monday from over the weekend, and then only 4 reported yesterday. So can you explain that drop and how the county's metrics shifted to keep us in the orange tier?
Yeah, so under the new rules for the blueprint, we have to have both the case count per 100,000 and the test positivity in a more restrictive tier to consider moving backwards into that tier. So last week we had both of those in the red tier, both the case count and the test positivity. We would have to get 2 weeks of that in order to move into the red tier. And on top of that, now they would be looking at our hospitalization rates and our hospital capacity before they would definitely move us back. So this week's case count was still in the red tier, but the test positivity rate came down into the orange tier. So we did not meet both metrics, which allowed us to get an orange tier for this week. Just in general, moving forward with the blueprint, it is much more difficult to become more restrictive in tiers, and that's by design. Now that we have a significant portion of our population vaccinated and protected, the reason for the strong protective public health measures of stay at home and restricting businesses, restricting public places, public movement, was to protect the unvaccinated and protect the hospital capacity. And at this point, we do not have a fear or worry that that the hospitals would be overwhelmed with COVID cases. So that's the reason for the rollback of the protections. That's the reason we're moving forward. The state is intent on moving forward with June 15th as the removal of all the blueprint restrictions on businesses and going back to a much more open and normal society.
Thank you. And I would just follow up with asking, have we seen this outbreak that we've been experiencing? Has it subsided or even passed, would you say?
Yeah, well, I think that's part of what we're seeing with the numbers coming down. There's still solidly, the red tier metric for case count and orange tier metric for percent positivity. So I don't think we're, people are always asking, are we headed to yellow tier yet? And I think the definite answer to that is no. The numbers need to come down dramatically for that. We are still seeing continued spread among businesses, schools, daycares, not necessarily in those places, but people who are related and hanging out together outside of work or outside of school or in the daycares so we're seeing this kind of spread still across the community. So I think we need, the way out of this is to continue to vaccinate, to get everyone who wants a vaccine to get one, to continue masking, continue distancing, and avoiding gatherings until we can get more folks vaccinated.
Thank you. That's all for now.
Thanks, Isabella. Any other questions about tier assignments from other reporters?
I have a question kind of related to this. Dr. Hoffman, you kind of touched on this a little bit ago, the state reopening and dropping that blueprint on June 15th. He said yesterday that if vaccination rates continue to stay constant, that we're going to reach the metrics required to drop that on June 15th. Do you believe Humboldt is prepared to open up on June 15th? And on that date, is public health kind of, maybe for lack of a better phrase, gearing up for this date, in the event that, the situation with the virus were to expand when things open up?
Yeah, we're definitely preparing. We're the main efforts we have going on are going to continue, regardless of what date the state puts on reopening. And those are vaccination efforts and contact tracing efforts. And I don't see an end to those anytime in the near future. Both of those will be going strong and robust public health efforts well into the summer and into the fall as well. So that's what we're preparing for. And again, these public health measures that were released, we're removing, we're there for a specific reason to protect the hospital capacity. And we don't see the high likelihood of our hospitals being overwhelmed. Not to say we're not going to see hospitalizations. We're still seeing them. We're seeing them from the current cases. And we're going to continue to see them as long as we have pockets of unvaccinated people out there who this virus can infect.
Great, thank you.
Any other questions on tier assignments? All right. Let's see. North Coast Journal, Thad Greenson.
Hi, thank you, Mariah. Dr. Hoffman, you mentioned, I believe, at yesterday's supervisors meeting that Humboldt County is working on developing local genomic sequencing capacity. And I'm curious to hear from you about that effort, when you think it might get online, and how that might help COVID response locally.
Yeah, it's a really exciting project. We have an incredible lab here for Humboldt County, has been for a really long time. I mean, this goes back decades. The lab has a long storied history of being a really strong public health lab. So we expect that later this month or early part of June, we should have sequencing online in the county. And I think it'll increase our response time for this pandemic, for COVID-19 response, and being able to get sequencing done faster, since we'll be able to do it in county. I don't think it'll increase the numbers at all, because we've already been sequencing at quite high levels. Anything that's sequenceable that comes from our lab gets sent to BioHub for sequencing. But just having that capacity here and having the ability to prioritize samples if we have an outbreak and we want to run those right away will allow us to be more responsive. And it has other applications as well for other viruses, other infectious diseases. So it's exciting. It's another great addition to this really strong, robust lab.
Excellent. And then I guess just to follow up quickly on that is, was this made possible through some kind of grant funding or partnership with other organizations? How are we making this happen?
Yeah, given the pandemic, there is quite a bit of funding for this out there. And so that's where the funding's coming from grants and, related to the pandemic. And the federal government's encouraging, increasing sequencing. They've been bringing online lots of labs, and the state has been supportive of this as well.
Okay, thank you.
Thank you, Thad. Do any other reporters have questions about genomic sequencing or the public health lab? All right. Let's see. We've got Hank Sims from the Lost Coast Outpost.
Hi, good morning. My only question was if anybody can tell us to what degree the recent surge here in Humboldt County has been driven by churches or church activity.
So, there's a lot of cases going on all over the place. We know that some of those are in churches, some of those are related to businesses. I mentioned daycares. When I say schools, I don't mean to say there's been any spread within the schools. We haven't seen any spread within schools, but we have had cases of children who go to schools and have had to quarantine folks. So, what degree that's been associated with specific church outbreak is hard to say, because we don't know for sure. Even if everyone in that group was associated with the church, how many of those people were at services? We weren't able to interview every single person there. But I certainly think what we saw was the virus, the UK variant was introduced into our community sometime around late March, early April, and really spread and probably was propagated through large gatherings that happened around that time. So whether those were in church or outside of the church is really difficult to say. But certainly many of the folks who were infected during that time period were associated with the church. So I think it's a lot of the churches are aware of this, and they understand that this is happening and that they're still susceptible. And so taking those measures to mask and distance and use precautions so that they don't spread this to their congregation.
I guess just, as a sort of follow-up, I mean, you're talking about genomic sequencing a moment ago. So my understanding is maybe incorrect or not quite correct, but is that you can develop, very detailed, like sort of outbreak trees to determine, where, a patient zero, as it were, of a particular strain, and that's spreading out into the community. So it would seem like perhaps that this is even quantifiable, like how much it was just to say the Pentecostal church outbreak, how much of the recent spread, how much of the is related to that?
Well, what we know from the genomic sequencing data is that there are multiple branches of the tree of the UK variant that got introduced in our community. So there was no singular introduction into Humboldt County. So it probably came from multiple sources. And yes, the Pentecostal church outbreak was a large propagator of that. Again, those folks, many of them we were not able to interview, so we don't know, were they at gatherings outside? Do they, was it in their workplaces? But certainly there's an association among those folks in that church that were exposed over that time period of early part of April. And we can see, but again, we can see that branching of the sequencing showing that there's multiple lines coming from multiple parts of the community. And so it's basically I think the take home from that is that it's out there in the community now, and it's the dominant strain. And it got into the Pentecostal church the same way it got into other businesses and other daycares. And then because it's a close-knit congregation, it was able to spread easily, especially among a large unvaccinated group of folks.
And just my last question on that is is public health getting cooperation from church leadership, from church communities? Are they participating with contact tracing efforts?
Yeah, the Pentecostal church leadership was very cooperative with us. We worked closely to get information out through their channels, to folks in their organization. They, worked with us around closing and reopening. So yes, I would say that was a very beneficial relationship. We are meeting resistance from contact tracing across the board. Across the community, and it's something that I hope we could encourage everyone to participate in, because it's a really powerful tool. If we want to say get to yellow tier, we got to be able to find the virus and stop it from spreading, and it's really difficult to do that if we don't know who's infected, who they've had contact with. And if people aren't, talking about who their contacts are. So I don't think that has anything to do with a particular church or organization or a business. It's something we're seeing across the board. We've been seeing it for months now. I think there's some fear and some fatigue, but the more we can participate in that contact tracing, it's going to help our community.
Thank you.
Thank you, Hank. Any other questions on that topic? All right, thank you all. KMUD News, Lauren Schmidt.
Thank you so much for taking the time. Yesterday, a local nonprofit announced that they will be holding a festival this June in Southern Humboldt and will not be requiring attendees to wear masks. Yet they say that this event is in compliance with the county's COVID protocols. Is that true? And what is the likelihood that this could become a super spreader event? Is DHHS concerned?
So the state has a statewide mask mandate, and as far as I know, that is not going to go away. So any public gathering of people who are in a public space would have to be masked unless they were entirely vaccinated. That could be, some situation where people could go if you were in a fully vaccinated private event that everyone had proof of vaccination. They could be outdoors without masks, without distancing.
And just really quickly for clarification, with the governor's full reopen, masking will still be required. Is that what you're saying?
That's what we're hearing, yeah. My my understanding is, I mean, so the blueprint is about restrictions on businesses and public spaces, public and private events. The mask order from the state is a separate order, and I have not heard that they are going to repeal the mask order on June 15th.
And finally, on this topic, could that nonprofit, face any repercussions for holding a large scale event and not wearing masks?
Yeah, I think any organization, business, private event, public event venue, who doesn't follow COVID protocols could face repercussions from, potential backlash from the community, obviously, press, bad press, and legal ramifications from someone if they were to become ill at a gathering that was clearly not following the guidelines. I think that the guidance is out there. We're encouraging people to follow the guidance, to helping them to understand which guidances apply to their events. We are moving away from the certification of events, given the retirement of the blueprint and the retirement of those restrictions, but we do encourage people to continue to utilize the precautions that are there to reduce the spread, because like I said, the virus is not going to go away after June 15th. It's still here. We're still going to see cases. So, continuing to do things like controlling the crowds, controlling the mixing, having people masked, potentially having people distanced, or having a safer event with everyone there being vaccinated or tested are still possibilities going forward from June 15th that people can choose to do and choose to make their events much safer for those who are involved in it.
Thank you so much.
Thank you, Lauren. Any other questions on that topic? All right. Redwood News, Taylor Elliott.
Hi, so I know that we've talked a little bit already about vaccines for kids and that authorization, but could you again just kind of go over how soon the county will be vaccinating kids for those parents that are looking forward to it? And then could you also talk about just kind of the importance of vaccinating kids when it comes to the overall vaccination effort and fighting COVID-19?
Lindsay, can you start with that one?
Sure. Hi, everybody. This is Lindsay Mendez. I think that to start with the 12 to 15, as what Sophia and I were saying before, is that when we were talking about public health clinics, we are currently planning a clinic for Pfizer so that we can have a public health mass vax for a larger age range right now. When it comes to how soon in Humboldt County, that is also dependent upon if the other pharmacies and other locations who have Pfizer are holding clinics, and you can find that on vaccinefinder.gov. So that will tell us, even if it gets approved right today and it starts to open up on my turn, you will have to look for a location that has that specific vaccine. And I'm just trying to be very sure of saying that. So I would encourage people to go onto Vaccine Finder and not just My Turn so that they can see that. And then the secondary thing about 12 to 15-year-olds and what does that play with the pandemic? Well, when you're looking at herd immunity of any population with any vaccine, you want the most people possible to be vaccinated so that you can get to herd immunity faster. And when you are losing a part of your population who is allowed to be vaccinated because of safety regulations, we're always very happy when the safety regulations say it's good to vaccinate even more parts of the population so that we can have herd immunity faster. And that's what I'm going to say as my part. And then I would like Dr. Hoffman to try to follow up with some of his thoughts about this.
Yeah, no, definitely, Lindsay hit it all right there. We're planning for it. We we will have clinics next week that through public health, those will likely be up either later today or tomorrow, latest, by Friday. So check back on my turn for the public health clinics. I know that many of the providers in the community are also preparing, and so they will be reaching out through their networks and their local, either through the doctors that they work with or through their local, media or social media to let people know when those clinics are going to be available. And then Vaccine Finder, the federal pharmacy partnership program, we don't know exactly when those are going to go live with the 12 to 15-year-old, but I know many of the pharmacies had already put up information as of the last few days saying, check back. So we're hopeful that many of those will start to vaccinate that age range as soon as potentially later this week or early part of next week. And then just, for what it means to open it up, it's more people who can get vaccinated. So it's going to decrease the potential pool of folks who can get infected. And that's, one step closer to being done with all this.
And then just following up is just for any, parents, families, caregivers, or whoever that might be on the fence about vaccinating your kids, what would be your message or your recommendations to them?
I would say what Dr. Hoffman said originally about finding a trusted care provider who you understand, or who understands maybe you and your family, who who you've been taking your child to or your family to consistently. If you would like resources, you can go onto the CDC website. You can also go to CHOP, which is the Children's Hospital of Philadelphia's website, and they have a lot of researchers and articles who will discuss the COVID vaccine in regards to pediatrics. So again, it's the Children's Hospital of Philadelphia. They are experts in their field and they often will help you with understanding vaccines, but I can't encourage it enough to talk to a pediatrician or talk to a doctor or a nurse practitioner who works in primary care, who you know very well and who you trust.
Great, thank you.
Thank you, Taylor. And I do want to clarify, both Dr. Hoffman and Lindsay have mentioned Vaccine Finder and vaccines.gov. Those are the same website. Vaccinefinder.org became vaccines.gov. So both work, but if you want to go straight to the source, you can go to vaccines.gov. All right, and
kind of a tradition in this pandemic to change the name of things every couple of weeks or months. So,
and we all just go with it.
Yeah.
North Coast News, Michael Patterson.
Can I follow up
hello.
on Taylor's question real quick? I'm sorry.
Yeah, of course.
Yeah, go for it.
Yeah, so just specifically to the 12 to 15 set, and I guess then hopefully down the line vaccinations becoming open to more children. I'm curious to hear from Dr. Hoffman and Ms. Mendez how they feel like vaccination rates in those demographics might impact what in-person instruction in local schools looks like come the fall.
I don't think it'll have any impact. I mean, obviously we want as many kids to get vaccinated as possible. And so we're gonna, just like we have with all the other groups, we're gonna create opportunities, try to break down barriers, promote the vaccine, talk about its safety, talk about what it does for people, and encourage people to get the facts if they are on the fence or have questions. And but as far as vaccination rates affecting how schools are going to be open in the fall, I don't see that having much of an impact. Meaning that I think that schools will make those decisions not based on other factors, not on vaccine.
Thanks very much.
Any other questions about vaccinating 12 to 15-year-olds?
Yeah, I would just ask, does the county have enough vaccine to begin vaccinating this group?
Yes.
Sophia, Lindsay, you wanna?
Yes, when we say vaccinating this group, I do believe, yes, the county has enough vaccine to begin vaccinating 12 to 15-year-olds at this time. And it's not just because of what the public health department has, but also what other providers have who are partners in this effort who will be vaccinating children in this age group. And as Dr. Hoffman was just saying, and also Sophia and myself, about how we are going to be planning a clinic specifically moving forward for this age group to be included. It's also true that the allocation rounds happen weekly again, and I will say that as I've said in the past. So as we move to the end of this week, we are going to be entering a new round of allocations and shipments. And how we will be ordering Pfizer will obviously change as we open it to more ages.
Thank you.
I'll just add to that. We have sufficient supplies of Pfizer right now in the county for public health, as well as all of the providers who want to vaccinate in this age group.
Any other questions on vaccinating the 12 to 15 age group? All right, Michael Patterson, North Coast News. Thanks for your patience.
Yeah, no problem. I just have one quick question about breakthrough cases for Dr. Hoffman. We've just been receiving a lot of inquiries from viewers about the status of, how many breakthrough cases have been seen in the community. I believe last month we heard about 10 breakthrough cases, mostly in healthcare workers that were already testing regularly and were non-symptomatic. We were just trying to see how many breakthrough cases have been identified now, and if that trend of being mostly among healthcare workers and being non-symptomatic is still the case.
Yeah, I don't have specific numbers for you. We're not really, there's so many things that we have to track. That's not one of the things we're tracking really closely as far as numbers. I mean, what we do track is we're really trying to pay attention to, are there any cases of severe COVID, someone who's hospitalized, someone who's really sick, who is vaccinated, fully vaccinated, and that is not something we've seen at all. So I don't have an update on specific numbers. Generally though, the trend has continued to follow what we know from the data from the trials from other counties across California, which is that it's a very small number of folks who are getting, true breakthrough. Some of those are probably also false positives. They have very, very, low level of virus that, could just be viral particles. So, we're trying to keep a close eye on that. We're trying to do genomic sequencing on these if we can to see if there's sequenceable virus. And so, if there's any significant updates on that, I think the things that we should be watching out for, what I'm watching out for, what public health officials are watching out for, health officers, is again, do we start to see people getting really sick from who are vaccinated? We know that people are going to get cold-like symptoms still, even if they're vaccinated, just like with the flu vaccine. It doesn't prevent 100% of the flu cases. You might get a milder case, much more mild case. It's going to prevent people from getting hospitalized. It's going to reduce our ICU admission rate for the flu, the same for COVID vaccine. So those are the things that we're watching out for going forward, not necessarily that it's preventing 100% of mild symptoms in people who are vaccinated.
Sure, thank you.
Thank you, Michael. Any other follow-up questions on breakthrough cases? All right, well, we have about 10 minutes left. I would like to just run back through and give reporters an opportunity to ask one more question. So we'll go back to time standard, Isabella.
Nothing for me, thank you.
Great, thanks very much, Isabella. And Thad from the North Coast Journal.
Yeah, thank you. So understanding that last week there were some hiccups with the transition to the state TPA, and shipments arriving in Humboldt County. I guess I'm just asking if you guys are confident that those have been ironed out and that shipments will be more consistent moving forward.
Sophia, can you speak to that?
Sure, and if Dr. Hoffman has anything to add, feel free to chime in. I will say, just with any emergency response, you know, we are agile and we adapt to the circumstances that are thrown our way. So can't say for certain something that's out of our control can be perfectly smoothed out, but we do everything in our power to make sure that we have enough vaccine supply for our community. So the moment we had any inkling that something wasn't gonna get shipped to us, we went straight into action mode and made sure that we secured enough supplies to make sure we were able to meet all of our appointments. And so that's the commitment we can make to our community, is that we're going to do everything we can to make sure there's enough vaccine supply. But there are definitely going to be external factors that are beyond our control, and we can only hope that those things get smoothed out over time as well. Anything to add, Dr. Hoffman?
Well, I'll just add that Sophia is being a little humble right now because she really, you know, went to the mat for this and made this happen, made those doses get here when they needed to, and along with a lot of folks at the EOC. So, you know, just she deserves a lot of kudos for that. And yeah, it was, we were in a precarious position for a number of days last week, you know, but we did exactly what the system is designed to do when there is an emergency. We put it into action, and Sophia and the rest of the team were able to secure the doses in a very short amount of time, and we did not have to cancel a single clinic. I do think that going forward, we've identified some concerning parts of communication and making sure that we close the loop much more firmly with the TPA each week around our allocations and the ordering system, which has been you know, another process that, just like the name of a website might change week to week, sometimes the ordering process changes week to week, and you know, that can sometimes lead to confusion and something like this happening. So, but we all worked together and it worked out great, and I don't think that'll likely happen again.
Thank you both. Los Coast Outpost, Hank Sims, do you have another question?
No, I'm good. Thank you, Mariah.
Great, thanks very much. And let's see, Lauren from KMUD.
Thank you. Really quickly, you know, vaccine hesitancy along with misinformation remains a big problem. Can you just briefly comment on the importance of verifying health information and just debunk any prevalent myths you're currently hearing?
Can you speak to that one, Lindsay?
Sure. As I've mentioned before, vaccine hesitancy can come in many forms, and one of the forms is myths. We have been trying to remove many of the barriers that are the other forms of vaccine hesitancy, like transportation and geography and communication barriers. But this one is probably the most difficult when it comes to any topic that can have myths or misinformation. We would always encourage people that when they are using something like social media, to stop and ask yourself, do you always believe everything your friends and family tell you, regardless of checking it twice? Probably not. We often have to check information all the time on news sources, and also things that our friends and family members tell us. So I would encourage everybody to try to go to a source and like the CDC, but if you don't want to just use the CDC, there are many other reputable sources that are accredited hospitals and research institutions in our country, including our own UC campuses in California, Stanford, Johns Hopkins, as I mentioned before, CHOP, which is the Children's Hospital of Philadelphia. There are so many resources that you can go to so that you can read or understand videos that they give you for training or community understanding with videos for persons that are not medical, so that you can see if the information that you're being told about a medication or a vaccination is actually accurate across the board. I know it sounds like a lot of work, but there's nothing in comparison to having your information wrong and not getting vaccinated and possibly being ill or dying from COVID-19. So I would encourage everyone to take the time to look for reputable sources that are not just on social media.
Thank you.
Yeah, thanks, Lindsay. Yeah, and I want to, I like how she's used the phrase that this comes in a lot of different flavors, right? This is not one thing, what we're seeing right now. And actually, the data is suggesting that the biggest group out there who hasn't been vaccinated yet are the group who want to get vaccinated. They are accepting the vaccine, but there are barriers to it. They have to work, they have kids, they have a tight schedule. They can't afford gas to get to a mass vaccination site or a pharmacy that's 20 or 30 minutes from their home or their place of work. And so that's actually the biggest group out there right now who isn't vaccinated. So we're working hard on that group to make sure that we break down those barriers, we get to them, we get out into those communities, we offer as many solutions for that as possible. The next group is a group of folks who are, the on the fence group who are just a little bit more ambivalent or ambiguous. They probably, given the right circumstances, would take it. And that's the group that I think that all of us, family, friends, if you have someone in your network, your family who's like that, reassuring them, telling them about your experience. I got the vaccine, I'm fine. It wasn't that bad, and now I feel safer. And that can have a really big impact on that person. As in addition to physicians and providers who see those folks, giving them their strong recommendation. It's okay to tell a patient, if you're a provider, I strongly recommend you get this. In fact, that's one of the most important things a provider can do, is to give their strong recommendation. I did it for myself, I did it for my family, and I think you should do it for you and yourself and your family. And then there's the folks who have firm, strong beliefs against this. And that's a group that's very difficult to persuade. There is misinformation out there. We don't look to propagate any one specific myth because there are so many. The best thing we can do for that group is just try to hear them and listen to them and offer them information that's truthful and factual in an open way that's not judgmental or belittling of their firm beliefs that this is something that it's not. So I think those are the groups we're left with, and we're chipping away at that as we go into the summer and the fall months, and trying to make as many opportunities as possible for all of those groups to get vaccinated.
Thank you both. Taylor Elliott, Redwood News.
Nothing for me. Thank you.
Thanks very much. Michael Patterson, North Coast News.
Yeah, nothing for me either. Thank you.
Great. Thank you all very much for joining us. We will see you again next week. Thank you to our panelists and our media representatives. Have a great day.